Thank you very, very much for having me this afternoon. I am particularly excited to be here and want to acknowledge just the amazing work of Mates in Construction, Mates et al. It's going on and on and on. It's just such an incredible organisation that at SuperFriend we've been involved in for and supporting of for many years now. I'm going to change tact a little bit this afternoon and just talk to you about some of the very, very hot off the press latest research that we've been undertaking at SuperFriend. Some of you may be aware that we have been conducting a national survey for a number of years now, our Indicators of a Thriving Workplace survey, and I am very pleased to share with you the very first time ever publicly some of the results of the 2018 data. I think the really exciting opportunity that we have when we conduct such a national piece of work and the opportunity to survey Australian workforce is to really understand what is working, what do they need from us in our roles every day, and how do we progress to a thriving workplace. So this afternoon we've heard a lot about suicide and suicide prevention. We've heard a lot about people when they are really struggling. I'm going to go to the other end of the spectrum and be talking really about how do we create thriving workplaces and how do we create people to be able to thrive in those workplaces. What is it that we can be possibly doing differently to really help them? So our Indicators of a Thriving Workplace survey is a national survey. It is an annual survey that we run. We have recently scientifically validated the indicators that sit behind this survey. So for some of you, you may have heard that previously we had 38 indicators. We now have 40, and they're scientifically validated. What we've known has been the world has shifted or changed quite considerably since 2014 when we first started this piece of work. So we wanted to update the work. We wanted to update what a thriving workplace actually is. And we wanted to be able to also make sure that the indicators were absolutely validated. So there was over 5,000 Australians who have been interviewed as a result of this survey. And it's important to recognise that they cover business owners, senior executives and senior leaders inside business, business managers, as well as workers. We've also had a representative sample for small, medium and large organisations and across multiple different industries. So for a national piece of work, this is really one of the only pieces of survey work that is being conducted in this space. I think the great opportunity that we see through this work is what is it telling us about where is Australia actually at. So let's have a look at some of the results. What we know from these results, and I'm pleased to say that this is much more validated, much more current than we've had previously, is that we've actually had an increased number in Australians that are recognised as dealing with a mental health condition at work. The number used to be 1 in 5 Australians every 12 months. Well, from this research, sadly, it's 1 in 5 at work every 12 months at the moment. We also know that 1 in 4 are experiencing high levels of stress in their job. And out of those that are experiencing high levels of stress, 1 in 5 are ready to pack up and leave the workplace in the next 12 months. I think the really interesting thing, and we've touched on this a little bit, is some of the new data coming forward is around workplace bullying. And we've got, out of the 5,000 plus survey respondents, 24% are indicating that this is a major issue. The really interesting one for me, because this is a topic that has come up more and more frequently than I've heard in the last 5-10 years, and that is around sleep and insomnia. And I appreciate that in federal police, often that is going to be shift work related. In other jobs, there is shift work related, but this is work-related stress, work-related insomnia in relation to things like shift work and other factors that are affecting people's sleep patterns. And we're sitting at 22% of respondents saying this is a major issue for them. 13% are saying that they're experiencing stigma in the workplace around mental health. And I think we've got a long way to go to reduce stigma. Organisations like Mates in Construction and the other Mates projects, the work that the AFP are doing, it's clear that this is a major target and a source of energy for us to actually really look at what can we be doing. I guess for your context and the work that many of you do here is to think about these results in the context of risk and injury. So when somebody is sleep deprived, if somebody is not sleeping well, if somebody is feeling harassed or bullied at work, if somebody is absolutely experiencing stigma at work, these are going to increase their risk factors for work-related injury and illness issues. So why are we not seeing more action? Well, for the very first time since we've been asking this question, the very first time in the last 4 years, lack of time is number 1 on the list. It used to be number 4. For us, we've started to think about, well, what does that actually mean? We know that there are things like lack of skills and lack of feeling confident to be able to step in and have conversations, the "Are you okay?" conversation, or "Hey mate, how are you doing? I'm really concerned about you" type of conversations. We know that that is an issue, and that there are some terrific programs out there addressing that. But lack of time, because everyone is too busy to say hello in the morning, to say, "Are you okay?" Really? So we were really surprised when we saw that this climbed up to number 1 on the list. For us, it's about asking the workplaces, are you asking the right questions? Because if we can crack this time issue as a barrier, then I think we're going to absolutely smash out of the ballpark things like stigma and things like not having the confidence to be able to have these conversations, because we'll open the door for more opportunities for training and other initiatives to help build people's confidences. So it's asking questions such as, how much is this impacting on your business, your bottom line of your business, as well as the social and health outcomes for your people? And how much do you as an employer or a people leader care about those 2 factors? Why aren't we making this a priority? What is getting in the way of this being a priority in everyone's business? The other 2 areas are looking at the lack of skills and training and looking at the lack of understanding. And I think that there's plenty of evidence and research around how to address those areas. There's some fantastic programs available, as well as there's some fantastic business cases that talks to increasing people's understanding about mental health and wellbeing issues. So where are we? We've done the 2018 results, and this is what it's shown. Is out of a score of 0 being really where we do not want to be, and 100 being a thriving workplace, as defined by the 40 scientifically validated indicators, we're sitting at 65. So we're about 2/3 of the way there. Interestingly, we're sitting in the sort of the mid-60s, I should say, for all of the indicators. So the indicators are broken across these 5 different domains. We have 8 indicators in each of these domains, and some of the opportunity is to look at what are the most important parts of, or important indicators within each of these domains. Unfortunately, because we have changed the questions, we've changed the indicators, we can't directly compare the 2017 and 18 results. But it is showing that we are slowly moving in the right direction if we were to stand back and look at it generally. What is also really important is that we've still got a ways to go. I think the great thing about this survey is that it does show the current state versus the desired state. So the desired state is very much there in our sights, and it's something that we should be all striving towards. And this is the unique survey that actually measures this. Some other indicators that we have looked at, and some questions that we have asked of the 5,000 respondents, is around what is it that would be for them in their belief system? What is it about a thriving workplace? What are the benefits to them? So this is their belief system. We heard things around that, they believe it's going to be an opportunity for them to be valued. We believe it's going to increase their ability to connect with their workplace and contribute even more in their workplace. It's going to give them greater optimism in completing tasks. What we were doing by adding this question was to ask about the positive aspects of what happens when you go to work in a thriving workplace. The absolute cracker of a finding about this is that irrespective of where on the spectrum of maturity or mentally healthy or thriving a workplace is as a result from the respondent, every single person was responding really consistently across these spectrums. So what this data is actually showing us is that if you're working in an organisation where you're thriving, you've got people engaged and you're thriving, that's what you want to be seeing, and that's what they believe will be the outcomes. And likewise, if you've got an environment where people are not coping, there's poor mental health, they're not connected, they're not engaged in work, then that's what they actually want to see, and that's what they believe will happen if their workplace is thriving. We also had 9 in 10 workers say that in a thriving workplace, so in an optimally healthy and thriving workplace, their job is a great one and they love it, and that they describe their employer as either the best or one of the best in the industry. So moving on, we wanted to have a look at which were the indicators out of each of these groups that was going to have the greatest impact on the results. In the leadership area, we looked at and found that leaders in the workplace who can be seen as proactively encouraging and promoting good mental health and policies and practices, i.e. walking the talk, living and breathing good mental health and wellbeing and being a good role model, was the #1 indicator. In the connectedness area, and this is the sense of belonging, this is the sense of mateship, this is the sense that we've been hearing about this afternoon, that sense of connectedness to work and to the people we work with. It's about our workplace feels like a community where people support each other beyond just getting the work done. In the policy area, which includes policies and practice, because policy on their own, as we know, doesn't actually save lives, doesn't make a cracker of a difference to people's lives unless they're actually implemented and lived and breathed. So in the policy area, people told us that they wanted to see greater action in the workplace. They need to have that communicated. They need to know what that action actually is. In the capability area, people in the workplace have the skills and the expertise to support each other and each other's mental health and wellbeing. So having the confidence and the capability to step into those conversations when you notice those early warning signs is a really important capability set for a sustainable and creating a mentally healthy workplace. The efforts that are made to help workers find purpose and meaning in their work is the overarching #1 piece to fit into the culture. We know from the work that we've done in analysing the data and analysing the results of this important survey is that culture is the #1 factor overall that makes the biggest difference. So if we have a culture where people do care for each other, people are walking the talk, where policies and practices are actually in place, where people have got training and understand how to utilise that training to save lives and impact on people, then we typically have a thriving workplace and a thriving culture. One of the great opportunities is for people in training is to have some way, like the connectors have on their hard hats, some way to recognise those in the workplace that have this special training, have this special capability to be able to step in. So I'm a very useful, practical kind of person. I like to see things in action. And so in thinking about the presentation today and to share with you some of the glimpses of this national survey and the results that we've actually had, I wanted to be able to bring that to life about what does that mean across all of the domains that we're working in. The first one is to understand what you already have invested in and to promote it extensively and frequently and consistently. I was in conversation with a large employer not that long ago, and they set about to improve their culture, including mental health and wellbeing inside their workplace. And the very first thing they did for the first 12 to 18 months was to focus on what they actually had already invested in and to promote that broadly, widely and consistently across their entire organisation. This is a large retailer with lots of little stores all over Australia. Their workers' comp premium came down substantially as a result of not spending a single cent on something new, but on promoting what they already had. And I think that in itself is a really great message to take back into your workplace. What are the things that you have already that you can actually be promoting? There is also a great opportunity to identify the gaps, and there are always areas of improvement, always areas in which organisations can address. There's a number of tools that are available to help you understand what you've already got going on, as well as what what the gaps are and what the opportunities are. I think one of the great areas about understanding what you've already got and what the gaps are is it helps you prioritise and work towards creating a sustainable change in the organisation so it's thriving. I'm really excited to also share with you that we are taking the indicators of a thriving workplace and turning it into a tool that will be available for employers, whereby they can benchmark themselves against the national results, as well as over time starting to benchmark against industry. We know that employers want to know, how am I graded against those competing organisations, and this tool will allow that to happen. But we also know that the indicators in and of themselves, such as one of them is people say hello in the mornings and use pleases and thank yous, some of those indicators are really easy to be able to modify and to uptake into your workplace. Engage your colleagues in co-creation and solutions using champions. Again, the MATES model is a wonderful example of how champions can be utilised. That co-creation, that using lived experience, using the people in your organisations, I think is probably the biggest success factor, in addition to senior leadership buy-in. We also know from the evidence that taking a whole of business approach, an integrated approach, not just the risk lens, which is incredibly important of prevention of harm, but to really bring the opportunity to promote the strengths, as the MATES model does. Take a strengths-based approach and promote the positive. What are you already good at? Build on that. It's also acting if somebody is unwell. How do you help somebody to get to the help that they actually need, irrespective of whether that is a work-related injury or illness or a relationship breakdown? And I guess the final tip is to measure what you do. If you can capture stories, if you can share the data and share the impact and know what your impact of your initiatives are and your whole of business approach can be, then you're likely to get continued momentum, continued change and sustained change. I'm also pleased to share with you some of the work that Comcare and SuperFriend and another number of organisations are involved in. I know that this was mentioned at the opening part of the conference, that there is a national workplace initiative that is starting to take shape, take form. This initiative is designed to really help every business, from a sole trader all the way through to a multinational operating on our shores, on how to create and sustain a mentally healthy workplace. There's been quite a lot of consultation done to date, unions, lived experience, people in different size businesses, different industries, rural, regional, as well as metropolitan, to actually understand the appetite for a national single source of truth to help in creating a mentally healthy workplace. It's early days. There are great opportunities to get involved and engaged. We are really proud to be part of this initiative. One of the key pieces that I can guarantee you I'm certainly driving home in the discussions we're having and the planning we're having about this work is to make sure it's practical, it's useful, and it's going to be able to be easily picked up and implemented into every workplace. So if you are interested in creating a sustainable and thriving workplace, then I would really encourage you to speak to Comcare, come and speak to SuperFriend or any of these organisations if you've got connections with them, and ask them about the National Workplace Initiative, because it is an exciting piece of work. I think it's going to be a great, innovative piece of work that is future focused and taking an aspirational view of how does Australia become the world leader in mentally healthy workplaces, and that's a really exciting place to be. So thank you very much. I'll hand back to Virginia because we've got question time. Thank you very much.